Sarah, thank you for the introduction. Again, my name is Adam Parks. I'm a neuropsychologist at KU. And a neuropsychologist is just a fancy word for somebody who looks at a person's thinking skills, their memory, their concentration, their problem solving, their language skills, sort of all of the above, in addition to behavioral functioning and emotional functioning, so mood and stress and things like that. And we do so using neuropsychological tests, which are mostly paper and pencil, sometimes on a computer type testing. And we primarily work with patients. We're housed in the Department of Neurology, and we primarily work with patients who have experienced some type of change in their cognition, behavior, and emotion due to a neurological condition. One of the most common of which is stroke. So I believe that our group and neuropsychologists abroad do have a very unique role in the identification and diagnosis of any type of cognitive, behavioral, and emotional difficulty following stroke, but also, and I think what's more important necessarily is the functional impact. How much the stroke has interferes with the impact of the stroke itself. It interferes with a person's day-to-day living and their functioning day-to-day. And so, it's one thing to kind of give somebody a test and get some scores on a test and see how they're doing on a test, but it's like, well, what does that even mean? How does that impact a person's real everyday life? And that's what I think we can do in neuropsychology and help patients really just try to return to as much of a normal life following stroke as much as possible. But today I'm going to be talking more broadly about stroke and neuropsychology and how it pertains to memory and attention skills. I think that was a prior name of the talk. I've kind of expanded the topics a little bit more broadly to include both the discussion of, really we're going to start off by just talking about the brain itself, just kind of an overview. Maybe some of you might be familiar with some of these terminology here. And then after that, we'll talk about what neuropsychology is. I already kind of gave a little bit of an introduction, but I want to cover that particularly because if you or a loved one could benefit from a visit with a neuropsychologist, then that would, if you walk out of here today with one thing and that's the only thing, then that would be, I've did my job. That's really great to hear. And then, as mentioned before, attention skills and memory skills will be discussed. These skills, these symptoms involving attention and memory, I think are some of the more common cognitive difficulties or cognitive changes that may be experienced after stroke. And I think it's important to discuss mostly just because these tend to have the most impact on a person's day-to-day functioning. A person's ability to focus and concentrate and pay attention is really sometimes the main thing that can then just sort of have a domino effect and impact every single other aspect of day-to-day life. And then memory is really important and very personal. It's very intimate. Our memories are kind of, sometimes I'll just say, that's who we are. Our memories make us who we are. And so I think it's important to discuss both attention and memory. And then at the end, I'll cover just some general tips for cognitive health. These will be behavioral and lifestyle type of tips, just generally speaking, to improve cognitive health. But I think a lot of these tips will be even much more important in the context of stroke. So we'll go over those as well too. And then, of course, I'll leave some in for time for questions if anybody has any, but please feel free to, I don't know if we'll interrupt or if anybody on the Zoom video wants to ask a question, and please feel free to. Okay, so let's start. Welcome to your brain. Everything you've ever known in your consciousness for your entire life has been housed in this, little kind of 1 foot by 1 foot area, a little less than that inside your head, inside your skull. And it's every single thought, every plan, every action, desire, anything you've ever wanted to do, everything you have thought about, emotions, fears, all housed inside your brain. So I don't have to introduce you to your own brain because you are very much intimately connected to it already. But just some general statistics about the brain. About 2.5 to 3 pounds is generally the size of an adult brain. It takes about 1 gallon of volume of space. 75% water and only 25% tissue. So you know what they say about our bodies, we're mostly water. That's true, of course, for the brain as well. And of that 25% tissue, 60% of that is fat. And so it's lipids, it's fat, not the exact same fat that you would eat in your diet, but somewhat derived from that. And then when we think about the brain itself, it only represents 2% of the total body weight of a person, of an individual, and yet it receives 15% of the blood supply and 20% of the oxygen use. So of course, when we talk about stroke, blood supply is absolutely at the forefront of any discussion of stroke. And in particular, the oxygen that is being brought in by that blood supply is that much more critical. So it's extremely important to consider when we talk about stroke, that the brain is just a powerhouse of consumption when it comes to the energy and the resources of blood and oxygen used in the entire body, even though it's just this tiny little 2% of the total body weight. So again, maybe some of this is review, but brain cells are called neurons, and I'll talk about those individually throughout the rest of the talk. And then there's, I don't know, maybe just a few 100 billion or so neurons in the brain. And there's, exponentially the number of connections between those neurons. And sometimes those connections are even much more important, what we call synapses. But the brain itself is divided into different regions and structures. And we'll talk about the major lobes of the brain here in a little bit. And I think this is important because most of the time when neuropsychologists think of stroke and really the identification of difficulties and deficits after stroke, it's important for us to think of the location of the stroke itself. And so if your loved one has had a stroke, sometimes the doctors will tell you where in the brain that is, whether it's in the frontal lobe or the temporal lobe or the parietal lobe. They might tell you if it's in the left hemisphere or the right hemisphere. Sometimes strokes are fairly small and focal. Sometimes they're buried deep in those what we call subcortical structures, so underneath the outer layer of the cortex of the brain. And sometimes they're widespread on the outside layer of the brain. And so it's really important for us to consider the location of the stroke, because then that can tell us, well, what brain areas are affected, what cognitive abilities are going to be affected by the stroke, and then of course, what sort of difficulty functioning in everyday life may arise from those deficits. And then again, sort of the difference between the cortex, gray matter, white matter are more of the connections between the brain. Sometimes strokes can be infiltrating and affect both gray and white matter. And that just goes to show that there can be more debilitating than, they may look small on an image, but they may be more debilitating because they affect more areas of the brain. And I've already mentioned there's 4 major lobes plus the cerebellum. Okay. So this is the 4 major lobes of the brain. This is the brain as if we're looking at a person, if you're looking at the left side of their head and they're looking to the left side of the screen. So this is their eyeballs would be here in the front, underneath the frontal part of the brain. Their ear would be kind of right here. And so we have, starting at the top left, we have the frontal lobe, which is the largest lobe of the brain. It's this blue one right here. We'll go into more about what these different lobes do. The parietal lobe, if we're working our way clockwise, is sort of the top back part of the brain. The occipital lobe is the very posterior, the back part of the brain. And then the temporal lobe is sort of to the side. And what you can kind of do, I sometimes illustrate this, if you just sort of take your hand and you kind of cup it like this. The frontal lobe is right there. The parietal lobe is kind of on the top. The occipital lobe is towards the back. And then the temporal lobe is, if you kind of cup it over your ear, that's sort of the area that the temporal lobe is covering inside in your skull. So when we go into more specifically the cognitive abilities that are important in the different lobes of the brain, the frontal lobe we think of as kind of being sort of the catch-all of what's kind of left over from all the other lobes, but it's funny I'm talking about this one first. But it also houses a lot of the much more complex thinking skills that are some of the most difficult thought processes that we can perform as humans. So problem solving, judgment, organization, planning, and then there's also aspects of attention, speech production. So our ability to take language and turn it into speech is also important in the frontal lobe. And then aspects of emotion regulation, motivation, impulse control. So we get some of that emotional behavioral aspect of in the frontal lobe, in addition to the cognitive abilities that I've already described. Next, we go to the temporal lobe. So this is on the side of the brain. And really, this is important in memory, in emotions, language, and auditory sensations. So what we call the primary auditory cortex, which is the sort of first major part of the cortex where auditory information comes that you hear, goes in and is processed towards the back part of the temporal lobe. Language processing is really important. So our ability to understand language, but also our ability to produce language is in the temporal lobe. And then memory abilities are sort of in the inside part of the temporal lobe. So it's sort of this funny structure because it's kind of I don't know how else to describe it, just kind of like this flap of tissue that goes over the brain. If you kind of pull back the flap, there's an internal structure that's really important to learning and memory, and it's called the hippocampus. The parietal lobe is up here towards the top, and this is important in sensation. What we call the somatosensory cortex is in this area. And somatic is kind of thought of as being part of bodily symptoms or bodily sensations, so touch, but also spatial awareness, visual spatial awareness, and then coordination of important movements, complex movements, is the connection between the frontal lobe and the parietal lobe. So our ability to perform complex motions and movements throughout our day-to-day life are produced by our interaction with the spatial awareness aspect of things, which is why the parietal lobe is implicated in those abilities. And then language comprehension is also important in the parietal lobe because of its close proximity to the temporal lobe. Now, visual processing, it's kind of fun if we think about our eyeballs as being sort of at the front part of our brain, right? You might think, well, where's visual information processed in our brain? Well, it actually is processed at the very back of the brain. So the visual information goes in through our eyeballs, it crosses over, and then it's processed in a couple of other areas inside the brain, and then it shoots back to the back part of our brain. And this is the occipital lobe. And so unfortunately, sometimes when a person might have a stroke involving the occipital lobe, they'll notice some visual changes or some visual deficits. And visual changes can happen if a stroke occurs at any point along that path that I just described, but oftentimes occipital cortical damage from a stroke can lead to long-lasting visual difficulties. And then, as I mentioned, cortex is sort of the outside of the layer of the brain. These, what we call subcortical structures, or underneath the cortex structures, things like the basal ganglia. I've already mentioned the hippocampus. These are just describing the underlying areas, but strokes can happen in the thalamus, which is sort of a relay station connecting all different other parts of the brain. A stroke can happen in the basal ganglia, and so these deeper structures can also strokes can occur, and sometimes they're much more debilitating because of the different connections between both the cortex and the other structures in the brain. And I've already kind of described the gray matter and the white matter, but this is just another view of that. And I've alluded to as well, so we talk about different parts of the brain, different areas of the brain, but sometimes it's the connections that actually matter more. So, if one part of the brain is not connected to or not communicating with another part of the brain in the most efficient way, as it was prior to the stroke, sometimes the disruption of that connection can be much more debilitating than just, say, a stroke happened on sort of one or other end of that connection. And we're learning more and more. I mean, so a rudimentary understanding of the cognitive or the neuropsychological effects of stroke, going back to the middle to later half of the last century, was just kind of studying those single points along the brain. So if one area or one structure was affected, now that we have more advanced brain scan technology, neuroimaging technology, we can look at these different connections. And so this is, I believe it's just an artist rendition, but the actual, what we call tractography, it's looking at the tracks of the brain and connections between the brain and the white matter. We actually can do this using functional MRI. And I've got a colleague in our epilepsy department that looks at functional MRI and the connections between the different important parts of the brain, particularly involving language. And then I couldn't talk about give a talk to a stroke group without describing the blood vessels in the brain, which is oftentimes the most important aspect when we talk about stroke. But these are just describing different arteries, and mostly I kind of put this up there just because either you or a loved one that has experienced stroke may be familiar with, say, the anterior cerebral artery or the posterior cerebral artery, because those are the major brain arteries that supply the brain with blood that may have been impacted by the stroke itself. And so the middle cerebral artery, which is oftentimes it's kind of over, well, it's on both sides, but that's one where when we have language deficits with stroke or speech changes with stroke, the middle cerebral artery is oftentimes the one that's been most affected by that. Okay, so we've completed our tour of the brain. Now just a brief description of neuropsychology itself. And so again, I kind of described a little bit of this at the beginning, but neuropsychological symptoms in neurological and neurosurgical conditions vary widely. It's, we have two people that have had a stroke or an injury to the very, very similar, almost same parts of the brain, and they can have two completely different outcomes. They can be experiencing those symptoms in two completely different ways. And so that's why it's important to take every individual at a time and not try to make it too broad generalizations, but at the same time, it's important to know, what different parts of the brain are important. Excuse me. So specific symptoms that can be experienced following stroke related to neuropsychology, again, include speech and language change, memory difficulties, concentration and attention, visual spatial processing deficits, reduced judgment and reasoning, and then emotional changes as well. Excuse me. And so before these advanced neuroimaging techniques like MRI and CAT scan came out, neuropsychologists were enlisted by neurologists to help identify the location of the lesion in the brain. And so a patient might come to the hospital and a stroke has been suspected. And then the neuropsychologist might implement some testing with the patient to determine the location of the lesion. Well, thankfully, the guesswork of that was kind of taken out whenever CAT scan came around, MRI came around, and but neuropsychologists stuck through and really sort of shifted the focus of these evaluations to the identification of, identifying symptoms, improving cognitive outcomes, and really determining the functional difficulties that a patient might be experiencing. So again, those day-to-day functional problems. So all neuropsychologists are doctoral level clinicians. Again, we evaluate cognitive and emotional abilities. I think education of patients and their family members are a really important aspect of our job. We have the luxury of being able to spend a great amount of time, particularly that time compared to our physician colleagues, spending time with patients, being able to identify their difficulties and then provide recommendations for further treatment or additional testing that might be helpful. And I've said it before, I'll say it again, but it's that term functional impact of neuropsychological conditions such as stroke that is most important to our job. So again, it's how much the stroke or the condition of interest impacts a person after they, outside of in everyday life. I apologize, some of that from last week is still sticking around with me. So I mentioned testing itself, and it's this sort of pencil and paper with a trained, what we call psychometrist, or a technician that's been trained to administer tests with a patient sitting at a table. The question might ask somebody to remember some words or make a design using blocks. Look at a booklet and identify a picture. So it's that type of testing. I sometimes joke and say it's kind of like you're back in school again. And these are all the different areas that we look at when we talk about when we use neuropsychological testing to identify cognitive and emotional changes after a stroke. And what's important about our testing is that we have the ability to make comparisons with the patient to a large a comparison group. And so our reference sample would be similarly aged, similar education level persons who are healthy, who have not experienced any kind of neurological condition or stroke. And so we're saying, compared to that group of people who are most similar to you as an individual, where would we expect you to be on these tests? And then we make a comparison between those expectations. And so we might see a patient who has, as I mentioned earlier, an occipital stroke, which is affecting their vision. And they may do very well on tests of attention, processing speed, memory, language, but then when we get to the tests of visual processing, those are much lower. And therefore we can identify those difficulties. There is a fairly large and growing contingent of neuropsychologists who work in the rehabilitation space, and they work with patients who are in that subacute rehabilitation setting following hospitalization and discharge into a rehab facility. Neuropsychologists will perform testing and then help the therapists and the treatment team with sort of following the patient over the course of their time in rehab and tracking outcomes. And obviously the goal there is to maximize outcome and return of ability following the rehabilitation. So that's a very unique and important aspect of a neuropsychologist's job, particularly when it comes to stroke, which we see oftentimes in rehabilitation. So more specifically, when we talk about attention, it's kind of one of those things where you don't really know that you're paying attention if you're thinking about your thinking, but there are times where we are able to focus and concentrate pretty well and get really deep dive into something that really interests us, like a hobby or maybe our work or studies if you're in school. And other times we notice that our attention varies. We're not able to focus so much. We get distracted easily. Usually it's, an electronic device or something that will beep at you or something, draw your attention away from us. You get distracted. And so attention is really, really important to everything else that we do, because if we're not able to pay attention to something, we are not able to remember it. We're not able to listen to it. We're not able to work through a problem or plan out a series of tasks because we're not able to focus in the first place. And so attention skills are really important when it comes to neuropsychological functioning. Excuse me. When it comes to the distinction, sometimes we talk about auditory attention versus visual attention. That kind of gets down into the specific tests that a neuropsychologist is administering. This idea of multitasking. I meet a lot of folks who tell me that they're really, really good at multitasking. That's not me. I'm going to take my hand down. I've never been really that great with multitasking, but some people feel like they're able to sort of juggle 3 or 4 or 5 different balls in the air at the same time. But really, when we talk about it from a neuropsychological perspective, what we're actually describing is the ability to shift attention back and forth. It's not that you're paying attention to 4 or 5 things at one time. It's that you're really able to shift your attention between 4 or 5 things at the same really quickly and very efficiently as well. So you're focused on one thing and you're able to focus something else, and you're able to focus something else. And it's that shifting of attention that really kind of looks like or mimics multitasking, but it really comes down to we're only able to focus on one thing at a single point in time. Now, when we talk about problems with multitasking, and that's oftentimes what I discuss with patients, is they'll say, I used to be really good at multitasking and now I'm not very good at it anymore. It's that shifting ability that's really been impacted. Yeah, so this is what I think I'm doing when I'm trying to multitask as best as possible. This is probably actually more realistically what it looks like. So then when we keep talking about attention itself, there's the ability to sustain attention over a long period of time. We talked about distraction earlier, such as that it's external, it's in the environment. So our phone or somebody coming in and talking to you, that's sort of an external distraction if you're focused on something. But an internal distraction could be our own thoughts or an emotional emotion that rises up. And so our own thoughts can in and of themselves be distracting, and sometimes are even more powerful than, say, an environmental distraction. So then describing memory, memory is one of the most complex cognitive abilities out there. It's extremely complex, and I think our neuroscientist colleagues really try their best to understand what memory is from in a laboratory type setting. But when I see patients in clinic, it's really more of, how does my memory, how is that affected in everyday life? And it's the ability to take in, retain, or hold on to and use information from the world around us. There's oftentimes this distinction between short-term and long-term memory. And then specifically when we talk about long-term memory, these terms are not necessarily as important, but what is described by these two terms, I think, is everyone can can relate to. And so when we talk about episodic memory, these are like episodes in time. And so if you remember what you had for breakfast yesterday, that's an episode in time, and that's related to your episodic long-term memory. When we talk about procedural memory, this is our ability to perform tasks and do things such as riding a bicycle, that you're actually accessing memory, but it's a procedure that you've done before. And so those are two different types of long-term memory retrieval. Again, I apologize. So I won't spend too much time on this because I think it's pretty self-explanatory, but our ability to pay attention to something is really important when it comes to memory. Both in the short term.
Adam Parks. Is that his name?
Yes. My name is Adam Parks. When it comes to long-term memory, well, with short-term memory, we have different abilities to remember things in the short term. And I'll talk more about these a little bit later on. I don't want to spend too much time on it. But the most important thing is this diagram is describing, the person's viewing the world in the immediate sense. So they're paying attention to the world around them. That information is then converted into short-term memory. And then there's a long-term memory. I'm sorry, one second. So I talked about attention abilities, and oftentimes there are problems with attention that are identified following stroke by a neuropsychologist, and some of the strategies for helping compensate for difficulties of attention range in different recommendations, but sometimes it could be something as simple as, if there's an environmental distraction present that's affecting a person's attention, then simply removing that environmental distraction is probably recommended. You can either remove the distraction itself or remove yourself from the environment that's so distracting. And so again, it sounds simple, but if you're needing to focus on something, or you're wanting to focus on reading something or filling out an important paperwork, or needing to complete some kind of task that requires your attention and focus, don't do so in the main common area of your home where another person might be watching television, or there's other noises and things. Try to find a quiet space, bedroom, home office, that kind of area that doesn't have those environmental distractions in place. Another thing that helps attention is to have a good plan in place in the beginning. And so this may be if I know that I need to focus on a task that requires my attention and focus and could be interrupted by distractions, then I'm going to plan to perform that task at a time, say, when other people aren't around, or I'm going to plan to do it at specific times of day, or specific places where I'm at. And so the planning aspect of that can sometimes set us up for success when it comes to our attention skills. Now, I know when you think about focusing and paying attention to stuff, the idea there is to just try to bear down and just stick with it as long as you can, and try to not avoid any distractions, any interruptions. But the idea here is to take planned breaks whenever you're trying to perform a task. And so there's a few different systems out there that recommend work for 20 or 25 minutes and then take a 5-minute break. Work for 20 or 25 minutes, take a 5-minute break. And so actually putting in these, planning in systematic breaks into your day-to-day life, especially when you're trying to perform a task that requires your attention, can be really important, because it gives you a little bit of a mental break. It lets you detach for a second, take a deep breath, and then you can get back into it. Another idea here is to, sometimes when we think about large projects, we sometimes have a hard time even getting started in the first place. And so it almost seems insurmountable you don't know where to begin. But sometimes it's easy just to break down those larger projects into smaller, more manageable tasks. And so it's not that I need to reorganize a room in the house, the entire thing all at once. It's, let me just start with one little area here. This will only take me 10 or 15 minutes. I can take a break and then I go back. And so it's this idea of making large projects or large tasks more approachable because you break them into smaller chunks. So we talk about memory. I skipped over these a little bit because I can talk about them here. When we talk about encoding, this is the learning of new information. So our ability to learn new information. How do you best set yourself up for success? And then it comes to with rehearsal and repetition, that is sort of saying something over and over to yourself again. That might be just in the short term. So if you're trying to remember a phone number or somebody's name, you might rehearse it in your mind a few times. That helps you better encode it. Chunking is a term that is described as taking a large piece of information and breaking it into smaller pieces of information. You're more likely to remember it if you chunk it into smaller pieces than if you try to take on that entire piece of information at once. And the mnemonics are sort of strategies or tips in how to remember something. This would be, taking the first letter of the word. You're more likely to remember it if you kind of remember the first letter in a string of letters than you would try to remember all the words at one time. Let's see here. There's a question in the chat, and it's actually pertaining to sleep. I do have a slide on sleep, and so I'll come back to that. So another strategy to help with memory and remembering things in the future, I know it sounds basic and pretty simple, but write it down. It's important information that you can write down and reference later. Not only will you have that information at a later date when you might need it, but the actual act of writing it down will help with memory. So you're more likely to remember something if it's been written down because you wrote it down. So there's an additional cognitive process involved in that writing it down itself. And you may write that information down in, say, a day planner or a calendar. This both helps with sort of note-taking and remembering important information from the past, but also future information as well. And then while I kind of derided the electronic devices or our phones for distracting us earlier, sometimes those beeps and reminders can be helpful because they are alerts and they tell us that there's something that we need to do. And so using those alerts and reminders, I would say, moderately, definitely moderate your usage of beeping on the phone. But they can be helpful to remember things because it gets your attention. It does create a distraction that's important. And then placing some type of visual cue, usually this is in the form of a note or some type of image that can help cue you to an important thing that needs to be remembered. A sticky note or something on the refrigerator or on the bathroom mirror could be helpful just because it's a place that you frequent oftentimes throughout the day at home or by the front door as you're about to leave. Try not to overdo it though. Sometimes I talk with patients and they say, "Oh, I use sticky notes," and I'm like, "Oh, that's good. You remember things." And they go, "Oh yeah, I have hundreds of them all over my desk." And I go, "Oh, that's probably not the best way to remember things." So I would say using them sparingly can be very helpful to compensate for memory. Okay. So now we'll talk about just general tips for cognitive health. And there are several steps that you can take today that will help improve your cognitive health. And the best part is that most of, if not all of these, are 100% free. So you don't have to worry about the cost of any of these. Now, there's this concept in neuropsychology called plasticity, and that just means that the brain can learn new ways of thinking through things. It used to be the old way of thinking was that our brains, when we're born, we're sort of born with a certain number of cells, of neurons, and then we don't ever grow any more neurons or connections ever again. We've since learned that the brain actually can create new neurons in certain parts of the brain, and the brain is always working on making better connections between the different areas of the brain. So those synapses, those connections between the neurons can change, particularly in the face of some type of injury, such as a stroke, through the use of rehabilitation. And so what we know from our rehabilitation science is that the recovery that happens in the brain following stroke through rehabilitation is due to this concept called plasticity. And so we can help best promote the process of plasticity, whether or not we ourselves have experienced a neurological condition like a stroke. Either way, we can benefit from plasticity either way. So one of the things our doctors have been telling us for years, and I'm not going to be any different, I'm going to really promote physical activity, physical exercise. And we know that it makes our bodies healthy, and our brains are part of our bodies. And so that's a pretty well understood concept. But on top of that, it can make our minds and our brain's functioning, our cognition, that much more healthy as well too. And so in addition to making our minds and our brains healthier, it does, of course, benefit our cardiovascular systems. And these are intimately connected to our cerebrovascular system, which is the blood supply to the brain. And so anything where you improve that connection between the heart and the brain is going to be a plus, especially in the context of a stroke. And in these physical exercises could be, I know that oftentimes a stroke can create a very impactful physical limitation that is challenging to overcome, weakness or difficulty walking. And there have been numerous exercise routines that have been developed, programs that have been developed for people that are needing to sit down. So there's various stretching programs. There's something called chair yoga, which is really great. I think there's been some stretching done this morning as well too. And so any type of physical exercise, it doesn't mean you have to get up and go run a marathon or anything like that. If mobility concerns, there's aquatic exercise, swimming. There's the usage of different exercise machines where you're seated, like a stationary bicycle. So there's lots and lots of options that is really strongly encouraged for every single person out there. So in addition to exercising our bodies, we can also exercise our minds. And so what I'll call cognitive stimulation or cognitive exercise is also positively related to cognitive outcomes. It's kind of one of those where, again, you use it or lose it when it comes to your cognitive abilities. And there's a point where our minds can get to a period of stagnation, or we're not really using our brains that much, and so our abilities we get a little rusty with our thinking skills, and it's harder to get back into it. So now the good news is well, the good or bad news is there isn't one specific type of cognitive exercise that's recommended. It can exist in all different kinds of forms. Sometimes I'll have patients say, you know, when they come in and they say, oh, should I start doing crossword puzzles to help with my brain? And I'll say, well, you know, maybe, do you like crossword puzzles? And if they say, oh no, I hate crossword puzzles, I don't like that at all, then I say, well, then why would you want to do crossword puzzles? So it's this idea of, you know, find something that is cognitively stimulating. It could be a game, a puzzle, it can be learning a new skill or a new hobby. Really, it's the idea is the novelty is really what's most important. And so if you say like a particular hobby, a type of sewing, that's a real big hobby of yours, maybe learn a different type of sewing, or a different form of crafting that's sort of, you know, ancillary to the hobby that you enjoy, but it's not the exact same thing that you've been doing for years and years. And the idea is you're sort of stimulating your brain by taking on the learning of this new skill or hobby that really is that stimulating activity. There's also the participation in discussion groups, social groups, groups that meet together, book clubs, study groups, things like that. Coming to this talk today is a form of discussion in cognitive stimulation. So everybody that's present today gets a +1 for that. And then, of course, you know, going to a presentation at the community center, at the local college, something like that could be really beneficial too. And anything that you can do that couples physical or even social activity with cognitive exercise, if you can sort of double up on any of those different activities, then you benefit that much more with it. So a social group that also involves exercise, or a cognitive stimulation task that also involves exercise. So if you can you do more than one of these recommended skills at a time, you get that much more benefit. Dietary lifestyle is really important, and there's not a one size fits all. There's oftentimes physician recommended dietary lifestyles that are for specific patients. But generally speaking, the ones that are most popular, but also the ones that are found to be the most beneficial for our brain health, are those that are balanced, contain a lot of fresh plant foods. The Mediterranean diet is one that's been out there for a few years now. There's actually a newer, improved version of the Mediterranean diet called the MIND diet, M-I-N-D. This is developed out of a team of folks up at Rush University in Chicago. And they actually combined the Mediterranean diet with the DASH diet, which some of you might be familiar with, the DASH diet from the AHA. And so what's nice is they took the best stuff from the Mediterranean diet, which is including, you know, lots of fresh fruits, vegetables, you know, lean fats, olive oil, things like that. And then they paired it with the best parts of the DASH diet, which is supposed to help with heart-related health and reducing hypertension. All right, so we had, like I said, a question about sleep, and there's sort of different areas of sleep that I could go on and on about, but the one that's most generally recommended is this idea of sleep hygiene. Now, the sleep is something that all of us have done, you know, thousands of times in our life, and some people say, oh, I sleep just fine, I don't have any problems. That's great. So you probably have developed a good sleep routine that involves positive aspects of sleep hygiene. Other folks out there might be struggling with their sleep, and so they might have fallen into different routine or behaviors that are not the most promoting, the most, I guess we could say, hygienic in a person's sleep hygiene. But this idea here is that it's the most beneficial to getting good sleep, because sleep is really, really important for the brain, the body, and poor sleep is actually a risk factor for stroke. And sleep-related disorders such as sleep apnea, insomnia, those increase the risk of stroke substantially. All right, so maintaining a regular sleep routine, that means going to bed and waking up at the same time every single day, even on the weekends. As much as I'd want to sleep, well, I can't really sleep in these days because I have a toddler, but if I wanted to sleep in on the weekends, I wouldn't want to, because that would be breaking my regular sleep routine if I'm waking up early during the week. So the idea is going to bed and waking up at the exact same time every single day. And then create in your bedroom what I call a sleep cave. And so what is a cave? Well, cave is dark, it is cold, so on a little bit on the colder side, and it's quiet. And so hopefully you're able to create your sleep cave where you have all of those things that would be most likely to promote a good, healthy amount of sleep. Avoid napping during the day. Sometimes this can be challenging, and sometimes it can be the cycle that we get into with our sleep where we have to nap because we're not getting good sleep. So how can you not nap if you're trying to improve your sleep? But as much as possible, avoid naps. And then using the bed only for sleep. And so that would be, don't, as much as possible, try not to do too many other activities in bed, such as watching television or, getting on our tablet or laptop. Really just sleep is key for the bed, because you don't want to teach your body or your brain to be awake in bed. You want to train it. You want to teach your body and your brain to be asleep in bed. And along those same lines, if you're trying to fall asleep and you can't fall asleep, after about 10 or 15 minutes, get out of bed. Don't stay awake in bed. Don't just toss and turn. Don't just lay there trying to hope and pray that you'll go to sleep, because again, you're teaching your brain to be awake in bed. So the idea there is to get out of bed and go do something else for a little bit, something quiet, something boring, and then crawl back into bed, and hopefully you'll go back to sleep. And then, kind of obvious, but caffeine, alcohol, nicotine, blue light, and exercise, all within the evening hours before bedtime, can be activating activities, stimulating activities that are recommended to be avoided. Now, stress and mood. Stress, we've all known for a while that stress has a negative impact. We've all experienced stress at some point in our life. But the idea that chronic stress can have a very detrimental impact on our brains and our bodies and our minds, even in healthy individuals who don't have any type of neurological condition or stroke. Stress also worsens those heart-related risk factors, the stroke-related risk factors, by increasing blood pressure, heart rate, and then impacting our sleep quality as well. And so how do we reduce stress and promote relaxation? So this idea of deep breathing, this is something that you can pull out immediately if you're feeling stressed out. So this is, sometimes there's this exercise called 4-2-4, where you breathe in for 4 seconds, you pause for 2 seconds, and then you breathe out for 4 seconds. And you repeat that over and over again. And it's almost like magic. It just makes you feel so much better. But the idea here is you're using your diaphragm, your belly breathing. If you kind of sort of take your one hand and put it on your chest and the other hand and put it on your belly, and if you practice deep breathing, if you notice your hand on your chest is rising, you're doing it wrong. So you want the hand that's on your belly to rise, and that's how you know you're doing the diaphragmatic breathing. Yeah, there we go. Then there's this concept called progressive muscle relaxation. This is where you sort of systematically tense and relax different muscle groups in the body. So you might start with your head and facial muscles, you tense and then relax them. Then you go to your neck and your shoulders, you tense and relax. And it's almost incredible and there's lots of free resources online. You just Google this and you can find any videos and audio to walk you through this process. But it's almost incredible to know how much you're tensing until you actually do something like this. You don't even recognize that you're sort of holding a lot of tension in your neck or your shoulders until you perform this exercise, and it definitely will point it out to you. Oh, yeah, here's a graphical representation of a person doing progressive muscle relaxation. And then there's this concept called mindfulness, and I think it's becoming more and more popular these days. So I don't, this may be a review for most of you, but it's this idea of just being in the present moment, being in the here and now, not having your mind wander to something that's happened in the past where you start to ruminate, or wander to anticipate something that's coming up in the future where you worry about it. It's really this sort of active process of keeping yourself in the here and now. And it's real hard to feel stressed about something if you are really fully in the present moment, because unless you're in some type of active, dangerous situation, there's not a lot around us right now in this moment that can cause us stress. So that's the general purpose of mindfulness. And I've always liked this graphic. So the person over the human over here is thinking of mindful. And this is all the stuff going in their mind. The dog over here is mindful. He's just in this present moment thinking about the space in front of him. So try to be this kind of mindful, not that kind of mindful. If we take the concept of mindfulness and we apply it to an actual relaxation exercise, there's this idea of meditation. Now, sometimes we hear the word meditation and you think of something like this, where you have to go out and sit on a beach somewhere, which, we have tons of in Kansas City, right? And meditate like this individual in this picture here, but that's not what I'm talking about. You don't have to go to those great lengths unless you are traveling and you want to. But the other idea is just find a quiet space in a chair or find a pillow and sit on the ground if you're able to, and just sort of focus yourself on the present moment, on your breath, and just even 5 or 10 minutes of this can be extremely relaxing overall. All right, so conclusions could be that based on the neurological illness such as stroke that we've discussed, of course, long-lasting significant impact on a person's cognitive abilities, including attention and memory, can really have problematic effects on a person's day-to-day life. Neuropsychologists can be helpful in understanding those changes in everyday life, those abilities of cognition, and help determine what are the best course of treatment and guidance for improving those abilities. But there are steps and actions that we can take today to improve our cognitive abilities and protect our brains from additional decline down the road if we take those actions today. So, oh, and lastly, I always say this at the end. So whatever is good for the heart is good for the brain. So if you're wondering if you should do something or perform some type of positive, healthy behavior, if you know that it's good for your heart, then it's automatically going to be good for the brain as well too. So, all right, thank you.